So we're looking at trypanosomiasis infections, which are usually caused by what? Trypanosomes of the genus what? Trypanosoma. Alright. Trypanosomes of the genus Trypanosoma. So for trypanosomiasis, we have the different types. We have the American type, we have the African type. Alright. So the American type is usually called the Chagas disease. While the African one is called the African sleeping sickness. So it's caused by what? Trypanosomes of the genus Trypanosoma. So there are two major forms of trypanosomiasis, just like we stated. We have the human African one, we have the American trypanosomiasis. So both forms are caused by protozoal species belonging to the genus Trypanosoma. So a number of other forms of disease usually occur. Alright, so for the human African one, so it's also known as sleeping sickness. Is caused by what? Trypanosoma gambiense. Okay, brucei. Sorry, it's brucei. Trypanosoma brucei. So it's transmitted by tsetse fly, also known as a Glossina species. This is a life cycle of it. You can pause to look at it. So it's curable with medication, but it's fatal if you leave it untreated. So there are other two species, like two subspecies of the Trypanosoma brucei. This is the gambiense I was actually talking at first. It's more common in West Africa. Then we have the rhodesiense. It's usually common in East Africa. So symptoms is what? It's caused by what? Either of them appearing in two stages as similar symptoms. In the first stage, the trypanosomes multiply in the subcutaneous tissue, the blood and lymph. So this is called the hemolymphatic stage. So early symptoms include things like the fever, headache, hepatosplenomegaly, dyspnea, tachycardia, blood in urine, edema, weight loss, aching muscles and joints, irritability. The second stage, the parasite crosses the blood-brain barrier to infect the central nervous system, causing inflammation of brain and spinal cord. So this is like the meningoencephalitis, okay, caused by what? Trypanosomiasis. So the condition is characterized by narcolepsy, you're sleeping too much. So hence, trypanosomiasis also goes with the name sleeping sickness. So this is a more simplified, what do they call it? This is a more simplified life cycle of the organism. So apart from excess sleeping, the advanced form of the disease is characterized by what? Severe emaciation, slurred speech, cervical glandular enlargement, increased muscle rigidity, insomnia, depression, convulsion, then coma. Right. So treatments. You can use drugs like what? Pentamidine, suramine for the first stage of both the gambiense and the rhodesiense. So drugs used in second stage treatment include things like what? Melansoprol. So it is currently recommended as the first line of treatment for rhodesiense form and the second line for gambiense form. Eflornithine is there. The nifurtimox. It's currently recommended as the first line of treatment for the gambiense and it's used in combination with what? Eflornithine. So it's also registered for the treatment for American trypanosomiasis.